Hi, everyone. Today, I want to chat with you about a health issue that perhaps many of us are silently facing: hypertension or high blood pressure, often called the silent killer. Would you believe that over a billion people worldwide live with it? And the scary part is, about half of them don't even know they have it. It's like a ticking time bomb, quietly damaging your heart, brain, and kidneys without any warning. But don't worry, I'm here to help you understand it better, recognize it, prevent it, and manage it simply and effectively. Let's get started. What is high blood pressure, and why is it dangerous? First, imagine your blood pressure is like the water pressure inside a hose. When your heart pumps blood through your body, the blood pushes against the walls of your blood vessels. If this pressure is too high for too long, it damages those vessels and vital organs like your heart, brain, and kidneys. Think of it like a water hose under too much pressure. Over time, it can leak or even burst. High blood pressure is similar. Left uncontrolled, it can lead to stroke, heart attack, and kidney failure. Complications none of us want to face. The most frightening part? Many people only find out when it's already too late. That's why understanding and acting early is key to protecting yourself. I often get asked, "Doctor, how do I know if I have high blood pressure?" And this is exactly what makes it so dangerous. Over 50% of people with hypertension have absolutely no clear symptoms. They go to work, laugh, live normally, but inside their bodies are struggling under the pressure. A lucky few might experience headaches, dizziness, blurred vision, or shortness of breath. But don't be mistaken, these signs aren't specific and are easily dismissed as stress or fatigue. So please don't wait for your body to cry out. The only sure way to know is to check your blood pressure regularly. Make it a habit. Just like brushing your teeth every morning, it's simple, but it could save your life. There are many misconceptions about high blood pressure that I want to clear up with you today. High blood pressure can be completely cured. That's not quite right. For most people, it's a chronic condition, meaning you don't cure it, but you can manage it effectively with lifestyle changes and medication if needed. Don't fall for ads promising a miracle cure. Most are just gimmicks. Only take medicine when blood pressure is high. Stop when it's normal. This is a dangerous mistake. Taking medication inconsistently creates a roller coaster effect. Blood pressure goes way up and down, which can damage your blood vessels even more than consistently high pressure. Always follow your doctor's advice and take your medication regularly. Blood pressure medicine harms the liver and kidneys. Not true. Modern blood pressure medications are very safe and often even protect your heart and kidneys. It's actually uncontrolled high blood pressure that's the real culprit behind kidney and heart failure. Understanding the facts helps you avoid unnecessary worry. Now for the best part: how can you manage high blood pressure without feeling miserable? I'll share some simple but incredibly effective tips. Cut back on salt. We mentioned salt is a major enemy, but how much is too much? Aim for less than 2,300 milligrams of sodium per day. That's about 1 teaspoon of table salt. Even better is aiming for under 1,500 milligrams, especially if you have hypertension. Start reading food labels. You'll be shocked how much sodium hides in processed foods, canned soups, and even bread. Cooking more meals at home gives you much better control. And instead of salt, get creative. Use pepper, lemon, or lime juice, garlic, onions, vinegar, herbs, and spices. It's a delicious adventure for your taste buds and great for your heart. Embrace a heart-healthy diet, like the DASH diet. There's a well-researched eating plan called the DASH diet. Dietary approaches to stop hypertension. It's not complicated. Focus on eating plenty of fruits, vegetables, and whole grains. Choose lean proteins like fish and poultry, beans, nuts, and seeds. Opt for low-fat dairy products. At the same time, cut back on foods high in saturated fat, cholesterol, sugary drinks, and sweets. Also, boost your potassium intake. This mineral helps balance out sodium's negative effects. Think bananas, sweet potatoes, spinach, avocados, and beans. Eating this way isn't just good for blood pressure, it's great for your overall health. Get moving. You don't need to become a gym rat. Aim for at least 150 minutes of moderate intensity aerobic activity per week. That could be 30 minutes, 5 days a week, brisk walking, jogging, cycling, swimming, dancing, even gardening counts. Find activities you genuinely enjoy so you'll stick with them. Consistency is key. Even short bursts of activity throughout the day add up. Remember to also include muscle strengthening activities at least 2 days a week. Relax and manage stress. Chronic stress can contribute to high blood pressure. Find healthy ways to cope. Try deep breathing exercises for a few minutes daily. Practice mindfulness or meditation. There are great apps for this. Spend time in nature, listen to calming music, or engage in hobbies you love. Prioritize good sleep hygiene. Aim for 7 to 9 hours of quality sleep per night. Connecting with friends and family can also be a great stress reliever. Manage your weight. Being overweight or obese significantly increases your risk. The good news? Losing even a small amount of weight, just 5 to 10% of your current weight, can make a big difference in lowering your blood pressure. It's one of the most effective lifestyle changes you can make. Say no to smoking, limit alcohol. If you smoke, quitting is the single best thing you can do for your heart health. Smoking damages blood vessels and raises blood pressure immediately. If you drink alcohol, do so in moderation. That generally means up to 1 drink per day for women and up to 2 drinks per day for men. Now, if your doctor prescribes medication, take it as directed, on time, every day. Don't skip doses or stop on your own, even if you feel fine or worry about side effects. Talk to your doctor first. These medicines aren't addictive, and consistency is crucial for keeping your blood pressure stable and preventing complications. Think of it as essential daily maintenance for your health. Knowing your numbers is empowering. When you get a reading like 120 over 80 millimeters of mercury, the top number, 120, is systolic pressure, the pressure when your heart beats. The bottom number, 80, is diastolic pressure, the pressure when your heart rests between beats. Both are important. Monitoring at home can give you and your doctor a clearer picture of your blood pressure throughout the day. But accuracy is key. Here's how. Choose the right monitor. Use an automated cuff-style monitor that goes on your upper arm. Make sure it's validated for accuracy. Ask your doctor or pharmacist for recommendations. Wrist monitors are generally less reliable. Prepare properly. Avoid caffeine, exercise, and smoking for at least 30 minutes before measuring. Empty your bladder first. Sit correctly. Sit quietly for 5 minutes before measuring. Sit in a chair with your back straight and supported, feet flat on the floor, legs uncrossed. Rest your arm on a flat surface like a table with your upper arm at heart level. Place the cuff correctly. Place the cuff on your bare upper arm, ensuring the bottom edge is about an inch above your elbow crease. It should be snug but not too tight. You should be able to slip 2 fingertips underneath. And then measure. Stay still and quiet during the measurement. Take 2 or 3 readings 1 minute apart and record the average. It's best to measure at the same times each day, like morning and evening. Keep a log of your readings, date, time, numbers, to share with your doctor. Regular checkups are essential, but there are times you should seek medical attention more urgently. Contact your doctor or seek immediate care if you experience symptoms that could indicate a hypertensive crisis, dangerously high blood pressure, such as a severe headache, often described as the worst headache of your life. sudden vision changes like blurriness or double vision, chest pain, severe shortness of breath or difficulty breathing, numbness or weakness, especially on one side, or confusion or difficulty speaking. Also, contact your doctor if your home blood pressure readings are consistently much higher than your target goal, despite following your treatment plan, or if you are experiencing persistent or bothersome side effects from your medication. Don't just stop taking it. Communication with your healthcare team is vital. High blood pressure isn't necessarily the end of the road, but ignoring it can steal your health when you least expect it. Remember, check your blood pressure regularly, live a healthy lifestyle, and follow your treatment plan. Don't let negligence today lead to suffering tomorrow. Right now, do this. Check your blood pressure if you have a monitor, or schedule a health checkup. And if you found this information helpful, please hit like, subscribe to the channel, and share this video with your loved ones. Who knows, you might just be the hero who helps them avoid a serious health crisis. Thanks for listening, and I'll see you in the next video. Wishing you all health and happiness.